friends, now I am going to talk about jaundice. What is jaundice? Jaundice, the word derived from French word jaune, means yellow. It's a clinical condition characterized by yellow color of the sclera of the eyes and skin. It is caused by the deposition of bilirubin due to its elevated levels in the serum. The term hyperbilirubinemia is often used to represent the increased concentration of serum bilirubin. The normal total serum bilirubin concentration is in the range of 0.2 to 1 mg per dl. Out of this, about 0.2 to 0.6 mg per dl is unconjugated bilirubin, while 0.2 to 0.4 mg per dl is conjugated bilirubin. Next, formation of bilirubin. How it is formed? Actually, bilirubin is a yellow colored pigment waste material that produced from degraded matured RBC in spleen and liver. Actually, 1 gram of hemoglobin yield about 30 mg of bilirubin. So, approximately 250 to 350 mg of bilirubin is daily produced in human adult. This is the diagram of heme degradation. Here, hemoglobin degraded into globin and heme. That is protein part and non-protein part. Here, non-protein part is a heme. Then heme degraded into biliverdin by the action of heme oxygenase. Then biliverdin converted to bilirubin. This catalyzed by enzymes biliverdin reductase. So bilirubin is water insoluble form, that is unconjugated bilirubin. Then it transfers into liver via blood. Here bilirubin, that is water insoluble bilirubin or unconjugated bilirubin is converted to conjugated bilirubin. So bilirubin is conjugated with 2-UDP glucuronic acid. Then it converted to bilirubin diglucuronide. So it here water insoluble bilirubin converted to water soluble bilirubin, that is conjugated bilirubin like bilirubin diglucuronide. Then the conjugated bilirubin enter into the intestine through the bile duct. Here bilirubin converted to urobilinogen by the action of glucuronidase. Glucuronidase is the microbial enzyme. Then the urobilinogen converted to stechobilinogen. Then it excreted in the form of stechobilin in fecus. And part of the urobilinogen excreted through the kidney in the form of urobilin in urine. If there is too much of bilirubin, it can leak into the surrounding tissues. This is known as hyperbilirubinemia, and it causes the yellow color in the skin and eyes. This condition called jaundice. What are the signs and symptoms of jaundice? There are itchiness, fatigue, abdominal pain, weight loss, vomiting, fever, paler than usual stool, dark urine. And causes of jaundice: acute inflammation of the liver, inflammation of the bile duct, obstruction of the bile duct, hemolytic anemia. Then Gilbert syndrome. This is an inherited condition that impairs the ability of enzymes to process the excretion of the bile. Then next condition, cholestasis. This is interrupts the flow of the bile from the liver. The bile containing conjugated bilirubin remains in the liver instead of being excreted. Rare conditions that may cause jaundice include Grigler-Najjar syndrome. This is an inherited condition that impairs the specific enzyme responsible for processing bilirubin. And Dubin-Johnson syndrome. This is an inherited form of chronic jaundice that prevents conjugated bilirubin from being secreted from the cells of the liver. Then pseudo-jaundice. This is a harmless form of jaundice. The yellowing of the skin results from an excessive beta-carotene, not from an excess of bilirubin. Pseudo-jaundice usually arises from eating large quantities of carrot, pumpkin or melon. Then classification of jaundice. Jaundice classified into three major types. First one, hemolytic jaundice and hepatic jaundice or hepatocellular jaundice. Then third one, obstructive jaundice or regurgitation jaundice. This diagram represents the types of jaundice, that is pre-hepatic or hemolytic jaundice, hepatic or hepatocellular jaundice, post-hepatic or obstructive jaundice. First of all, hemolytic jaundice. This condition is associated with increased hemolysis of erythrocytes. Example, incompatible blood transfusion, that is mismatching blood group. Cross agglutination is occur. Here RBC restriction is high. Then malaria and sickle cell anemia. And this results in the overproduction of bilirubin beyond the ability of the liver to conjugate and excrete the same. In hemolytic jaundice, more bilirubin is excreted into the bile, leading to the increased formation of urobilinogen and strechobilinogen. Then hemolytic jaundice is characterized by elevation in the serum unconjugated bilirubin, increased excretion of urobilinogen in urine, dark brown color of fecus due to high content of strechobilinogen. This diagram represents the pre-hepatic or hemolytic jaundice. That is high level of RBC breakdown. So the formation of bilirubin level is increased. Then second type, hepatic jaundice or hepatocellular jaundice. And this type of jaundice is caused by dysfunction of the liver due to damage to the parenchymal cells. This may be attributed to viral infections, that is viral hepatitis, and poisons and toxins, that is toxins like chloroform, carbon tetrachloride, phosphorus, etc. Then cirrhosis of liver and cardiac failure, etc. Among these, viral hepatitis is the most common damage to the liver, adversely affects the bilirubin uptake and its conjugation by the liver cells. Hepatic jaundice is characterized by increased level of conjugated and unconjugated bilirubin in the serum, dark color urine due to the excessive excretion of bilirubin and urobilinogen, increased activities of alanine transaminases and aspartate transaminases released into circulation due to damage to the hepatocytes. The patients pass pale clay colored stools due to the absence of strechobilinogen, and it affected individuals experience nausea and anorexia, that is loss of appetite. Then third one, obstructive jaundice or regurgitation jaundice. This is due to an obstruction in the bile duct that prevents the passage of bile into the intestine. The obstruction may be caused by gallstone, tumors, etc. Due to the blockage in the bile duct, the conjugated bilirubin from the liver enters the circulation. Next, obstructive jaundice is characterized by increased concentration of conjugated bilirubin in serum. Serum alkaline phosphatase elevated as it is released from the cells of the damaged bile duct. Dark colored urine due to elevated excretion of bilirubin and clay colored fecus due to the absence of strechobilinogen. Fecus contain excess fat indicating impairment in fat digestion and absorption in the absence of bile. The patients experience nausea and gastrointestinal pain. This is the classification of jaundice and their causes. Pre-hepatic or hemolytic jaundice. Here unconjugated bilirubin level is excess. It caused by hemolysis, abnormal RBCs, then antibodies, drugs and toxin, thalassemia, hemoglobinopathies, and hepatic or hepatocellular jaundice, increased level of produced by increased and unconjugated and conjugated bilirubin, caused by viral hepatitis, toxic hepatitis, intrahepatic cholestasis, Gilbert syndrome, Grigler-Najjar syndrome, and third type post-hepatic or obstructive jaundice. Here conjugated bilirubin level is excess and caused by extrahepatic cholestasis, gastron, tumors of the bile duct, carcinoma of the pancreas, carcinoma of amla of Vetter. This diagram also same different type of jaundice and their causes. Treatment. The following treatments are used. Anemia-induced jaundice may be treated by boosting the amount of iron in the blood by either taking iron supplements or eating more iron-rich foods. Hepatitis-induced jaundice requires antiviral or steroid medications. Doctors can treat obstruction-induced jaundice by surgically removing the obstruction. If the jaundice has been caused by use of a medication, treatment for involves changing to an alternative medicine. Prevention. Jaundice is related to liver function. It is essential that people maintain the health of this vital organ by eating a balanced diet, exercising regularly, and not consuming more than the recommended amounts of alcohol. Then another type of jaundice is neonatal jaundice. It mainly occur in newborn babies. Jaundice is a common health issue in newborn infants. Around 60% of newborn experience jaundice, and this increases to 80% of premature infants born before 37 weeks of pregnancy. They will normally show signs within 72 hours of birth. Red blood cells in the body of an infant are frequently broken down and replaced. This causes the production of more bilirubin. Also, the livers of infants are less developed and therefore less effective at filtering bilirubin from the body. This condition is called Kernicterus. Symptoms will usually resolve without treatment within 2 weeks. However, infants with extremely high bilirubin levels will require treatment with either a blood transfusion or phototherapy. In these cases, treatment is vital as jaundice in newborns can lead to Kernicterus, a very rare type of permanent brain damage. This the Kernicterus, that is deposition of excess bilirubin to brain, mainly basal ganglia. Treatment, phototherapy, that is exposure of skin to white light, that is photoisomerization of bilirubin to water-soluble lumirubin, which is excreted in bile without conjugation. Thank you.